Hello friends, this is Shubham and today I will talk about some basics in appendicitis. Through this video, I will talk about the anatomy of the appendix, definition of the appendicitis, etiology, pathophysiology, about the clinical manifestations which are signs and symptoms for these patients which are specific for the appendicitis, physical examination, diagnosis, some lab tests or investigations, and lastly about the treatment and complications. So, firstly, before discussing about the appendicitis, we should know what is appendix and where is it located. So, let's talk about the anatomy of the appendix. Actually, our appendix is usually 8 to 10 centimeter long on an average and ranges from 2 to 20 centimeter. Actually, the appendix is a hollow muscular tube which comprises of 4 layers. So let's talk about the layers over here. Here I have drawn the lumen of the appendix. And these are the different layers of the appendix. So this is our lumen, for example, for the appendix. And the innermost layer is the mucosa. Following by the mucosa, here is the submucosa. Here we have muscularis layer, which consists of the muscles, and following to that we have serosa. So these are the 4 main layers in the appendix. First we have lumen. This is the lumen. This is the lumen of the vermiform appendix. So these are the layers: mucosa from the inside to the outwards, mucosa, submucosa, muscularis, and serosa. Actually, at the time of birth, our appendix is small, and with the time, as the cecum grows, it extends towards it extends into the muscular tube, which we call as vermiform appendix. And also with the growth of the cecum, our appendix moves into the retrocecal position, but intraperitoneally. So this was about the anatomy of the appendix. Now let's talk about the definition. Definition, as you can understand by this word, appendicitis, which means simply the inflammation of the vermiform appendix. Let's talk about the etiological factors of appendicitis. As you all know, appendicitis may be the acute or chronic, depends on the severity of the patient. Let's talk about the etiology. What could be the etiological factors for the acute appendicitis? Now, first of all, if there is any obstruction in the appendix, it can cause the appendicitis. So it is the major cause of the appendicitis. For example, there is any ficoli which causes the obstruction of the appendicitis. For example, this is our cecum, the part of the colon, and here hollow muscular tube, this is our appendix, for an example. Now, if there is any ficoli comes over here and got stuck in the appendix, so what will happen? It will obstruct the appendix and will cause the inflammation of the appendix, which will further obstruct the venous outflow, as I will discuss in the pathophysiology just after this. So the ficoli or any other obstruction can lead to the appendicitis. Now, any tumor or carcinoma can also be the cause for the appendicitis. Any foreign body can also obstruct the appendix and further can cause the appendicitis. Now, these were about the etiological factors, that what could be the etiology of the appendicitis. Now, after this, let's move on to the pathophysiology of appendicitis. Also, one more point about the etiology, that here we have the lymphoid cells around the appendix. So if there would be the lymphoid hyperplasia, it could lead to the acute appendicitis. So this can also be the cause, you can add in the etiology, that lymphoid hyperplasia, this can also be the major cause for the acute appendicitis. Now, let's move on to pathophysiology. Also, the appendicitis is a very common cause for the abdominal operations or for the abdominal pains. And one more thing about forward to discuss about the positions of the appendix. Let's talk about the positions of the appendix. Positions of the appendix. Usually, in most cases, at the time of birth, as the cecum grows, it converts the position of vermiform appendix into the retrocecal and intraperitoneal position. But in some of the cases, it could be the different positions. For an example, the most common one is the retroperitoneal. Now, this is the retrocecal, which is exactly behind the cecum. In 74% of the people, retrocecal position is there as far as appendix is concerned. Now, the less common is the pelvic position, which is 21%. The paracecal position 2% of the persons have this position of the appendix. Subcecal, 1.5% of the people could have this position. Preilial, 1% of the people, and posterior, 0.5% of the people could have the appendix position below the ileum, that is the post ileum. Now these were the positions, but the most common, as you can see, the retrocecal position of the appendix is the most common one, and in about 74% of the people, the appendix is situated retrocecally, that is exactly behind the cecum. Now let's talk about the pathophysiology of the appendicitis. Pathophysiology. As I discussed in the etiological factors, that major cause of the appendicitis is the obstruction. Now, this obstruction, how this obstruction will lead to the appendicitis? Actually, this obstruction, what will it do? It would inflame the area of the appendix. How? Actually, as the appendix will be obstructed, for example, and here, about here is this is the obstruction, and this will be inflammation. In the lumen of the appendix, it would be the, as there will be the obstruction, it will be the constriction in the lumen of the appendix. So mucosa around it will start to secrete the more and more mucus. And because the intraluminal pressure of the appendix is increasing, our mucosal layer will start to secrete more and more mucus. And what will happen? Now this mucus will start to accumulate there. There will be the stagnation of the mucus, which will lead to bacterial invasion. And as there will be the invasion of the bacteria, there will be the high WBC count in the blood. There will be the leukocytosis. So this is the cause. Also, if the intraluminal pressure will increase, it will obstruct the venous outflow. As you all know that actually the terminal part of the ileocolic artery is coming from the ileum. It is joining the appendicular artery. For example, here is our ileum. Okay, so here, this is the ileocolic artery, and here in the continuation of the ileocolic artery, here we have the innervation of the appendicular artery. So this is the vascularization of the appendix. Appendicular artery actually gives the blood vessels to the appendix. Now, as there will be the obstruction, there will be the increase in the intraluminal pressure, so that could cause the obstruction of the venous outflow, which will again lead to the bacterial invasion and can lead to the perforation or gangrene, and later it could cause many complications like peritonitis or abscess. So this is about the pathophysiology. Now actually the afferent nerves goes from here to the 10th thoracic segment. Now, for example, here is the vertebrae, and about here is the T10. Now afferent nerves are going through here and ends it over here. Now these carry the pain sensations to the T10 segment, and the efferent nerves comes from here. So actually these are the work of the T10 sympathetic nerves. These are the T10 sympathetic nerves which carries the signals from the appendix to the 10th thoracic segment, and from there the efferent nerves are coming on, and this kind of pain, this kind of reflex, actually we call it as viscerosomatic pain. Which means due to the organ, there will be the pain in the body. Our appendix is in the right lower quadrant, so in this patient there will be the right lower quadrant pain. I will talk about this in clinical manifestations. So this was about the pathophysiology of the appendicitis. Let's talk about the clinical manifestations, that how these patients are going to present to you. Clinical manifestations. What would be the signs and symptoms which are one particular for these patients? Now, these patients will have nausea, vomiting. They don't want to eat, which means they have the anorexia. They have the nausea, the vomiting, anorexia. There will be the right lower quadrant pain. The pain will radiate towards the right iliac fossa, radiating pain towards the right iliac fossa. So nausea, vomiting, these patients don't want to eat anything. They have the anorexia, which means loss of appetite, right lower quadrant pain, radiating pains towards the right iliac fossa. So pain in the periumbilical region, periumbilical colic pain. Periumbilical colic region pain, because the T10 sympathetic nerves takes the sensation from the right lower quadrant and gives back the efferent nerves to that region. So there will be the right lower quadrant pain and near the periumbilical colic region. So these are the signs and symptoms, you can say, with the patients who are particular for appendicitis. There are some signs when you are examining the patient, physical examination of the patient. Let's talk about them, which can confirm you whether any particular patient has appendicitis or not. So the physical examination. First of all, pointing sign. What is it? You will palpate the abdomen, specifically in the right lower quadrant, and the patient will feel pain. That is the pointing sign, which means, if it is positive, that could you tell something about the appendicitis. Now we have Rosen sign. What is the Robson sign? That if you will press in the left side of the abdomen, the patient will feel the pain in the right side, right lower quadrant. Means if you are pressing in the left side of the abdomen, the pain will elicit on the right side. That is the positive Robson sign, which could be more particular in the appendicitis patients. Obturator sign. Obturator sign. The patient would lie down on the bed. For example, this is the patient. Okay, this is the leg, and the one leg would be like this. Means you will flex the leg of the patient towards him and inwardly rotate the leg. If the patient is feeling the pain in the right lower quadrant, that is the positive obturator sign. So you will flex the patient leg towards him and you will internally rotate it. And if the patient is feeling any pain in the right lower quadrant, which is the positive sign which is the positive obturator sign, which is particular for the appendicitis patients. We have one more sign which could indicate about the appendicitis. That is the source sign. Now the patient is lie in this position. Okay. Now you will ask the patient to move his leg in the upward direction, and you will resist his leg in the downward direction. And if the patient is feeling pain in the right lower quadrant, which means this patient have the positive source sign, because here is the source muscles. Now these are the signs when you are physically examining the patient. If these signs are positive, that could indicate about the appendicitis. Now let's talk about the diagnosis of acute appendicitis. Diagnosis of acute appendicitis. So it's diagnosis. We can have kidney ureter bladder test. We can have the ultrasound, CT scan, urinalysis of the patient. You can go for the liver function test. So these are some tests which could tell you about the patient, whether the patient is suffering of appendicitis or not. For example, in the kidney ureter bladder, you can check about the kidney functions, how they are functioning, and about the ultrasound and CT, you can make diagnosis very clearly about the appendicitis. Now, if you talk about the lab investigations, what would be the change in the body? For example, in the blood. Lab investigations. You will go for the complete blood count, CBC, and there you would find, if you will find the increased count of WBC, red blood cells, which means leukocytosis, which could be the positive for the appendicitis. Now you can check for the C-reactive protein also. Also in these patients there will be the neutrophilia. Neutrophil count will be higher. WBC count will be higher than 10,500 cells per microliter in the blood, or more than 11,000 cells per microliter. There will be the left shift. Now this was about the lab investigations that more particularly the leukocytosis and the neutrophilia. Now more important, how you're gonna treat these patients once you diagnose the patient with acute appendicitis or appendicitis. How you're gonna treat these patients? So let's talk about the treatment. First of all, as they don't want to eat, there must be the bowel rest. So NPO, nail paros, there should be nothing through mouth. As these persons don't want to eat, they should have the electrolyte balance. So we should go for the IVF, intravenous fluid. Also, as there is the invasion of the bacteria, there will be the antibiotics. For example, cefotetan and cefoxitin. These antibiotics are more preferable, and as these patients will have the pain, we should give the analgesics. Also, these patients suffers from vomiting, we should give them antiemetics. And at last, of course, we should remove the appendix, appendectomy, open or laparoscopic. So this was about the treatment, that there should be nil paros, means there should not be anything by the mouth, intravenous fluids, antibiotics for the bacteria, analgesics for the pain, antiemetics for the vomiting, and at last appendectomy, open or laparoscopic method. Now if we will talk about the complications, what could be the complications of acute appendicitis or appendicitis? Complications. If there will be the more obstruction of the appendix, and the appendix is gonna inflame, the epithelium of the appendix is gonna degranularize, and it's gonna thinner and thinner, and which may cause rupturing of the membrane of appendix, and which can cause the complication like peritonitis or abscess. So these could be the complications in the case of appendicitis. that if there will be the rupturing of the membrane of the appendix, it can lead to peritonitis or abscess, which is not good, of course. So this was about the basics of the appendicitis. We have talked about the anatomy, definition, etiology, pathophysiology, clinical manifestation, what would be the signs and symptoms, physical examination, diagnosis, lab investigation, treatment, and last, complications. So this was all about the appendicitis. I hope this video will help you, and thank you for watching this video.